Welcome again, fellow scholars, to Clinical Psychology. Today we have Chapter 17, Health, Psychology, and Behavioral Medicine, Key Terms and Definitions. Let's get to it. Behavioral Medicine, a broad interdisciplinary field of research, education, and practice that integrates the behavioral sciences with the discipline of medicine. Biofeedback, a wide array of procedures through which a patient learns to modify or control certain psychological processes, usually monitored by an apparatus, and the information is fed back to the patient in the form of a signal. The patient then attempts to modify the signal using a variety of techniques. Cognitive behavioral methods, techniques that emphasize the role of thinking in the etiology and maintenance of problems, and attempt to modify the patterns of thinking that are believed to contribute to a patient's problem. Controlled drinking, a controversial approach to the treatment of alcohol problems that has as its goal light to moderate drinking. Coping appraisal, in protection motivation therapy, the evaluation of one's ability to successfully avoid or cope with negative outcomes. Coping model, an individual who demonstrates effective coping in a stressful situation. Observing or applying a tape of such a model may be useful for individuals who are about to experience similar procedures. Coronary heart disease, a disease that involves damage to the heart muscle and is due to poor blood supply. Extinction, the elimination of an undesired conditioned response by creating a situation in which the conditioned stimulus is no longer associated with the environmental stimulus that initially generated the response. Health behavior model, a theoretical model proposing that the relationship between a hostile predisposition and health is mediated by the performance of health behaviors rather than the psychological aspects of stress. Health psychology, a specialty area within psychology that applies the tools of the discipline to the prevention of illness, the enhancement and maintenance of health, the identification of the correlations of illness and health. Operant conditioning, the principle whereby behaviors that are reinforced tend to reoccur, whereas behaviors that are not reinforced or are punished tend to decrease in frequency. Prevention. In health psychology, the idea that by performing a few simple behaviors consistently, people may dramatically reduce their risk for health problems and reduce healthcare costs. Procedural information, descriptions of what will actually occur when one undergoes a stressful medical procedure. Protection motivation theory, a model of health behavior that posits that behavior is a function of both threat appraisal and coping. Psychosomatic medicine, a field that is based on the assumption that certain illnesses and diseased states are caused by psychological factors. Relapse prevention, strategies for patient relapse, usually for addictive behaviors. Relaxation, a state of lowered anxiety, stress, and psychological arousal. Relaxation may be induced in a number of ways. Self-efficacy, people's beliefs about their capacity to control or gain mastery over the events that affect them. Self-monitoring record, a record often employed in cognitive behavioral treatments on which individuals monitor the occurrence of a certain emotional response, including the situation that triggered the strength of the emotion, and physical or behavioral reactions and their thinking processes at the time. Sensory information, descriptions of the sensations that will be encountered when one undergoes a stressful medical procedure. Social support, the number and quality of one's social relationships. Sympathetic nervous system, the portion of the nervous system that is responsible for mobilizing body resources in urgent situations. Prolonged sympathetic actuation, I think it's right. I can't pronounce my own words, can have adverse effects on body organs, mental functioning, and immune system. Threat appraisal, the evaluation of regular factors that affect the likelihood of or engaging in a particular behavior. Transactional model of stress, a model that views stress as a process that involves an environmental event and it is appraised by the individual. Type A behavior, a personality pattern that has been associated with increased risk for coronary heart disease. Thank you for joining us for Chapter 17 of Clinical Psychology, Health, Psychology, and Behavioral Medicine. Thank you for listening, and good luck studying out there!